So my name's Alis. I'm an orthoptist and it's AHP Day soon on the 14th of October. I would love to know more about allied health professions. What do you do?
Hi, Elise. My name's Matondo, and I'm a paramedic. Uh, I work as a paramedic for the Yorkshire Ambulance Service. I'm employed as a paramedic as well as a team leader within the service. So my role as a paramedic involves responding to emergency call-outs, which can be both emergency and non-urgent. It involves treating people at scene who are in most severe need of an ambulance, where it's life-threatening condition, or it involves where they just need a potential referral to a GP. It's many different range of calls that we tend to be dispatched to from a patient who's elderly and fallen at home, which would need to get them off the floor using manual handling equipments, and then assess the mobility and potentially refer them on to the falls teams in the community to be assessed. However, we do also deal with emergency life-threatening conditions where, for example, someone's been in a road traffic collision or they suffer from a heart attack and they may need medical interventions, and then taking them to a specialist hospital or specialist department for further treatment. And
Oh, wow.
yeah, also my side of the team leader line managing side involves line managing a team of staff. So at the moment, I've got approximately about 25 staff that I line manage as well. So which means doing appraisals, or also known as performance development reviews, and then also doing ride out shifts with them on the ambulance, assessing their scope and assessing the following the Yorkshire Ambulance Service values and providing the patient care that they employ to do.
Okay, brilliant. So that sounds like a lot within your career. How do you get to that place? Like, what was your journey throughout since leaving school? How did you become a paramedic?
Yeah, so after completing my GCSEs, I went to college to do a level 2 health and social care at college. When I finished my level 2 health and social care, I went on to doing level 3 BTEC extended diploma, so which was a further 2 years at college, which I really enjoyed doing that because it opened up, my knowledge and experience as to this is the kind of job potential I'm going to, or what it allowed me to know what patient care was really about, because there were different subjects that when I went to university was relevant. So I completed the level 3 health and social care, and then I went to University of Greenwich in London to study my bachelor honours in science in paramedic science, and that was a 3-year degree course. And I really enjoyed that course because the mentoring that I managed to get through my mentor was amazing. The exposure of the patient care will really enabled me to become the paramedic that I am today. And given working within London, it's a fast-paced, busy city, which enabled me to see a load of different conditions and a load of patients where, again, they were in emergency need, and some who they just needed signposting to alternative care pathways.
Mm. Oh, wow.
Yeah. So how about you? Tell me about your journey since leaving school, and what does your role entail of?
So I did GCSEs and then went on to A levels. I had a bit of a weird path into orthoptics. I originally wanted to go into dentistry because I knew I wanted to go into healthcare, but not medicine, and I wanted to specialize straight away. And I didn't know that all of these allied health professions existed. So I went straight for the dentistry route, and I did biology, chemistry, and maths A levels. And I did all the UK CAT and the interviews for dentistry, and I got some offers, but I didn't get the A-level grades. And through clearing, I got offered orthoptics, and I was obviously like, what is that? I've never heard of this before. And I couldn't even pronounce the name for a while. So I walked into my local hospital in Kingston, and I just literally walked in. I just followed the signs to the eye clinic, and I asked if they had any orthoptists there, and they did. And I shadowed 2 orthoptists. who actually one of them now I worked with as well. So it was quite nice. She was my mentor initially, and now she's a good friend of mine. So I just sat in, I watched, and I just couldn't believe it because it was the perfect combination between dentistry and primary school teaching, which was my two different alternate careers. Um, and we do a lot of visual development problems for children. So all the squints, the amblyopes, the patching, all of that with the kids. Whereas with the adults, we have more of the stroke, so the visual field problems, any brain tumors that cause eye movement problems. So we look a lot at eye movements, how something in one part of your brain can stop you from looking that way, all of the cranial nerve palsies, things like that. So yeah, it's really interesting. And your eyes are kind of like the extended part of your brain, so you can see a lot of what's going on in there. So it's a lot of neurology as well that we do. So it's really interesting. So I did the degree. I went for it after doing the day of work experience. I was like, yeah, why not? Let's give this a go. And I'm so glad that I did. I took the leap, and it's a 3-year degree. They have universities in Sheffield, Liverpool, and Glasgow in the whole of the UK. So it's a very niche course. I went to Sheffield and the Yorkshire lot,
Yeah,
so
yeah.
I absolutely loved it. I had the best time ever. We had the Peak Districts right there with lots of walks. The university life in Sheffield is really, really great. And the course is quite small again, maybe about 20 to 30 people on the cohort. So you got to know all the lecturers, and it's a small world in itself. So and once you're done, because you do 9 months of placement throughout the 3-year degree, once you're done, you're straight away in the qualified profession. You can see your own patients, and you just go right in. So yeah, that's orthoptics. I took a bit of a weird route, but I made it in the end. Yeah. So how come you chose paramedic?
Your pathway to becoming to your role seemed very amazing, and you sound very passionate about your role. That's what I really like as well. Well done.
Yeah, I love it. No, it's really good. You too.
Oh, that's good. Sorry, and what was your question?
So how come you chose paramedic? Was it something you always wanted to do, or just like me, accidentally happened?
Yeah, to become a paramedic is something I've always wanted to do since the age of 15. So just prior to leaving high school, around year 10, year 11, it was something I really wanted to do. And seeing ambulances around on the road, I used to be like, wow, that looks really cool. And I started from young researching what does a paramedic do. So I knew from early that a paramedic provides patient care. A paramedic is someone that people call in times of need, and a paramedic is someone who represents the NHS as a whole as well. Because someone who's in need, we call it 999, and you're becoming on blue lights to provide that patient care. So I knew what the job would be like, and yeah, and the skills and qualities of a paramedic, I felt like I had them. Like I'm a really good communicator. I'm very empathetic with people. I'm very compassionate towards others and my patients that I deal with, of course. And I felt like these skills and qualities, what they were looking for, I had them or I could build upon as well. So, which it was something that I started showing a great passion and interest towards, and it was just plenty of research that I just kept on doing in my free time, and then yeah, that's how I just ended up applying for college as well, and then hence it making to what course I wanted to do at university. And I believe that if you've got a passion with something, you'll kind of steer towards it as well, which led me to what I do, and I really enjoy being a paramedic.
Oh, brilliant. And you mentioned in the beginning what it's like as a whole, like all the interesting things that you do. But what would be your typical day, like your mundane day? What would be your average day like?
So it varies. So I'll give you two examples. First example, when I'm doing a on the road shift on a big ambulance. So when I'm working as a crew with another colleague, this involves me being a paramedic or working with another paramedic or what we call a ASW, ambulance support worker, or another grade such as another clinician of some sort within the ambulance. Yeah, so we'll come in on a morning. For example, a shift might start at 7 a.m. So I tend to come in at least 15, 20 minutes early to just get myself into work mode, potentially have a drink or familiarize myself with the station if it's a new location, and then pick my van. I pick the van that I would like to work in because we've got a range of different ambulances. For example, where I work, we've got some Mercedes ambulances, we've got some Fiats. So I'll pick the one that I'd like to work on, and then I'd start checking the vehicle, making sure we've got enough medicines, we've got enough equipment for at least 2, 3 patients before potentially we may be required to come to station and restock. So I'd make sure I've got all the equipment that I may need for any sorts of emergency that we may be dispatched to. And yeah, and then after that, when the vehicle is ready, I'd either key on for duty immediately, or however, just inform dispatch of our delay, and then would be dispatched to an incident, which sometimes, depending on the call stack, as soon as you key on for duty, you may go to a job straight away, or you may have some downtime. And with that downtime, I generally tend to do some e-learnings or do some light reading or just catch up with some colleagues. So yeah, we'd be dispatched to an incident, arriving at the incident, would assess the patient depending on the condition, and either provide medical treatments, or if we don't need to provide medical treatment, we may signpost them to alternative care pathways, or we may take them to hospital. It all just depends on the patient presentation and their clinical signs as well. And then after that, either we do take them to hospital or leave them on scene with worsening care advice. And then after that, if either we've ended up hospital or still on scene, we'll clear for another incident, and then the same cycle starts again. And at some point, after a few jobs, we'll get a meal break, some sort, stand down, come back, recompose ourselves, and then we'll be back on the road again up until toward that 7 o'clock mark, if it's a 12-hour, for example, and then we'll call it a day and go home.
Wow, that sounds really variable and exciting.
Yeah. How about yourself? Why did you choose to be an orthoptist?
Orthoptist. You'll get there eventually.
It's a mouthful.
Orthoptist. Well, I said that it accidentally kind of happened. But if I did know about it, that I wish that I had all this extra stuff that we have now, with like a lot more online presence. Because at the time it was quite difficult to know what it was apart from actually physically going there. But I wish that I had gone again, done some work experience, also called up universities, asked them lots of questions because they're always really happy to ask. And online we have this society called BIOS, British and Irish Orthoptic Society, that has loads of resources on there. So I think it would have been a lot easier for me to choose orthoptics, even though it accidentally came to me. But yeah, so my day is a bit different to yours, I'd say. It's a lot more rigid, 9 to 5, Monday to Friday, because it's always outpatients. Like, eyes can always wait in most cases. So it's unlikely that we're ever going to do any sort of night shifts or anything like that. But there are lots of types of environments that you can be in. Most orthoptists work in hospitals, but you can also have community clinics. You can be within schools. So I lead a school screening service where we go to special needs schools. So we do that once a week. We also have smaller outreach clinics as well that lots of departments can have. That I'm at Royal London Hospital, so it's a big hospital full of all the trauma, all the ambulances. And it's really great. It's nice here. I've got my own room. We get to sit and do all of our admin if we've got on admin, and do lots of audits, collect data. We're really keen on service improvement and making our services best for the patients. I personally am lead for the IIH, which is idiopathic intracranial hypertension. So it's a neurological problem, so a problem with the brain where if you have high pressure in the brain, you can lose your vision. And unfortunately, this happens a lot with obese women who are of childbearing age. We don't know exactly what causes it, but likely some sort of hormonal problem. And you can end up having really bad problems with the back of the eye because of this. So the only way forward for that, we can give some drugs such as acetazolamide, but the main treatment is to encourage healthy weight loss. And that is something where historically a lot of doctors have been like, do more, eat less. We'll put a shunt in your brain if you don't lose this amount. Whereas orthoptists are now coming in, we're bringing in dietitians as well. So a lot of the allied health professions are coming together to help this patient group to have those healthy weight conversations as well. So I'm really enjoying that project at the moment. So it's always about improving the service for these patients, especially when it's things outside of an ophthalmologist's range of work as well. I also, as I said, lead the school screenings. So we go to all the special needs schools, and there's a big push at the moment to make sure that everybody with special needs has a school screening check and is entitled to one. So it's really important that orthoptists are there and optometrists as well that we work with a lot. We go in and we check the back of the eyes of these children and make sure they're all nice and healthy. And I also need the adults with learning disabilities. So they're a vulnerable patient group who, within Tower Hamlets especially, it's very easy for them to get lost in the system. But they do require a lot more work than just any other adult. So we have a lot of different ways to go about this. We organise along with dental, so we liaise with them, and also lots of health professions to do when we put the patients under general anaesthetic and we do a full eye check, full dental check, full health check. We try and get everything at the same time for these patients who wouldn't usually let us do our normal assessments on them. So yeah, it's just lots of different ways that we're trying to improve the service and make it accessible to everybody. But it's the 9 to 5. We have 2 sessions, an AM clinic, PM clinic, and we can be put in any of them. So the pediatrics with the squints and the vision development, or with the neurology of the adults, with all the different things going on, or sent to the schools, or lots of different things. It's very variable, but it is less 12-hour shifts, which I don't know if I could hack. I don't know if I have that in me.
Yeah, definitely a different type of working compared to mine, because we do some 12 hours, some 10-hour shifts as well. And then there's the unsocial shifts that would do, some night shifts, some half night shifts, or some night shifts that we'd be doing is like at 1800 to 6 a.m. And then there's some like 1800 to 4 a.m. And then we've got some half night shift that you may categorize as 1400 to 2 a.m. So it changes, and it sounds like you work with a quite large team of from different departments as well, and your day-to-day working is very different compared to mine, really.
Yeah. I mean, I suppose I'm just on one bit of the body, whereas you're just everything as well. So mine is a lot more niche. It's outpatients only. Like, no, we do have an emergency eye clinic as well, where we'll see all the third nerve palsies, things like that when they come in. And it'll be a paramedic that will be writing the notes, the referral letters, and we'll go to A&E as well. So we're all connected. All the NHS is connected. We all work together for the patients.
Which is, well,
Yeah.
when we do, when we assess patients, some of the body systems we assess would be neurological, and we tend to do the cranial nerves as well. So which it overlaps with what you do.
Exactly. It always overlaps. Yeah, so what would you say for somebody who wanted to become a paramedic? What would be your top tips if, let's say, somebody doing GCSEs and they're thinking about doing it but don't really know how to go about it?
Well, for me, it'd be a big yes, go for it. So if someone wanted to do it, especially if they're doing their GCSE, I'd be like, go for it. And the main thing that I'd say to them to be wary of, just do plenty of research first. Know the research, do the research, and know what you're putting yourself into, because the job that we do, you're front line. You never know what to expect next. So you might be going, for example, to a sick child. to potentially a maternity job delivering a baby, or next you might be going to someone who's in cardiac arrest and you're going to have to do CPR on the person. So the job can vary, and you never know what's next, and it depends on your time and place. So I'd say to someone considering to go into this job, do your research, go to open days, whether it's at colleges, to speak to staff regarding health and social care, or if it's universities that are offering open days or taster days, go for it. There's no such thing as being too young or too old for the role. If you're finishing towards high school, go for it. Go speak to a lecturer. Yes, you may not be there yet in terms of knowledge. You've not done university, just college just yet. However, by just speaking to them, you're having a little bit of taste and knowing that, oh, this is my dream job, what I really want to do. So by doing that, you're setting yourself up as well to know this is my expectations, this is how I may have to behave, or this is how professionalism is, and this is the kind of attitudes that they're looking for. Because in any organization that you're going to go into, there's something called visions and values that you'd have to adhere to. So if you're able to have some sort of understanding of these things from early, it will help you as well to commence your path.
Yeah, wow. So it sounds like you really need to be able to adapt because you're just sort of chucked into anything. So you just got to get on with it, really. That sounds amazing.
You've got to be very flexible because, for example, the shift patterns that you'll be working can change. And sometimes there's a bit of short notice change, or they may send you to a different location to work with another colleague because of staff sickness. So you need to be, flexible and adaptable to your setting. And as well, being a people's person and communication is a big thing. So if you've got the communication skills and that people skills, at the height of it all, you'll be able to adapt and you'll be able to work within any setting in the paramedic world.
What would you say? Because I can imagine you'd have to be quite thick-skinned, like if you're seeing a lot of traumatic scenes or dealing with people who aren't in their best space. What would you say would be the challenges to be a paramedic?
I'd say that there's some challenges that you can overcome. However, the challenges would be definitely the exposure that you've been exposed to. Because some incidences that you may go to, for example, you may be dispatched to a road traffic collision involving two cars head-on collision, and because of the nature of the impact, some people might be thrown out of windows, or they might be banged from one chair to the other. They might have lost limbs, just depending on the nature of it. For some people, that can affect them really much, and it may not want them to do the job anymore. So, especially if someone's wanting to go into the job, they need to have that sort of understanding as to these are the kind of potential jobs I may see. However, this is my coping mechanism. For example, my coping mechanism normally is I'd go speak to family, obviously without saying any patient confidential information. I'd be speaking to them just to kind of help me overcome it. Or sometimes as well, speaking with colleagues, again, without patient confidential information, just picking little bits and seeing if they would have done the same. That sometimes makes me feel better. However, there's also some counselling that managers can put in place for you. You can also contact your own GP and get some kind of counselling through them, or just someone to speak to regarding if it's affecting your mental health. So there is things in place such as occupational therapist and departments where you can do self-referral and speak out really when things are just not too great. And it does get us all in different ways, even if you're thick-skinned or you're not. But we all get touched to some extent. There's little things that may just
Yeah, but it sounds like you're well supported though, and as a team, like you come together as a team and help each other out, which is brilliant.
Of course, yeah. So how about yourself? Is there any tips that you'd give to become an orthoptist?
Orthoptist.
Yeah.
Maybe by the end of this, I would say, as I said, shadow, go talk to universities, get yourself just familiar just with the eyes in general. Just do a bit of research, and the more you look into it, the more interesting it is as well. Like you just think, you just see with them that there's a lot of things going on and how they're connected to the brain, and just get interested, because then things will be difficult throughout the degree. There are topics that you'll find hard that don't play to your strengths. But if you always have that sort of passion, or you know the career that you get out of it is something that you want to do, and if you haven't done the research, then you can't hold on to that as well. So I'd say definitely look for the whole career in a general. And I would also say, again, the people side of it all, we're very much, we see patients face to face every day. So I know a lot of the world works from home now, which is quite nice, but we're in every day. It's an NHS job, so it's important to want that sort of, it's high adrenaline. You're always on your feet. You're always walking and talking to people. So as long as you've got that love for talking to people, you've got that love for connecting to patients and helping people. Um, I would say another challenge would be that you have the responsibility for children's vision. So it is as well, you've got to always try your best to do everything that you can for this child, but also there are things that can happen, or there are things out of your control where a child might not have the vision that you wanted out of your appointments. But it is also accepting that as long as you've tried your best as well, and that you've gotten through that, then and you work with the parent, you work with the patient, because you're not only working with the patients, it's also the parents who might have some expectations as well. So it's just about being able to de-escalate situations. It's about being able to communicate fully what's going on, because a lot of what happens is miscommunication or misinformation about conditions. So it's very important to have those sort of skills. And if you don't, during the degree we have 9 months of placements, so you can work on that. You can definitely build on it. And it's just about, it's what you make of it as well. Like some people just want to see kids all day, and that's all. There are lots of hospitals that just do that. Some people are interested in more of the complicated, the back of the eye stuff, the neuro, the brain stuff. Whereas other orthoptists might be interested in something completely different, like glaucoma, which isn't an orthoptic thing, but we can become advanced clinical practitioners. So we can become the same as an ophthalmologist. Well, not the same, but we can become in the same clinic. So we can do see the same patients that ophthalmologists do, if we upskill further as well. So there's lots of scope for many conditions. And if you don't like one, then there's many that you will find eventually. But yeah, I don't know, that was a bit of a detour, but tips would be just give it a go, try it. And even if you don't like it, there's teaching opportunities, there's research opportunities, that there will be something for everybody within orthoptics. It's just about giving it a go and finding out for yourself, really.
And you mentioned about placements and shadowing. How easy is it for someone, wanting to do that potentially in the future, to kind of shadow one of the staff? How do they kind of go about to doing that?
So if you want to shadow and you haven't done the degree yet, you're just interested, you can contact, as I said, with the British and Irish Orthoptic Society. There's an email on there in the careers page, and you can contact them and they can set you up with work experience. Alternatively, you can do what I did, which was just walk in and just ask. And it's a small profession. We want people to join. So definitely just walk in, and I'm sure people will be happy to have you for the day. But the placements that we do during the degree, in the first year, we're more shadowing, we're observing, we're doing the basic tests. And then in the second year, we go more to like diagnosing ourselves, suggesting treatments. Whereas third year, we're pretty much doing it on our own. The orthoptist sort of leaves you to it, sits in the corner, and you feel very, very equipped with everything, because the degree teaches you really well. So yeah, lots of different ways that you can do it. We've got a couple of questions through Instagram that have come through. Should we go through those? Thank you to everybody who sent in those. So somebody asked, can I become a paramedic with spinal fusions? Currently have level 3 health and social care. So what would you recommend for this patient? Sorry, this person.
Yeah, so the individual with the spinal fusion wanting to do the course, it's great. They've got a level 3 qualification. That's really good. It's a good starting point to any kind of degree qualification, having done a college or level 3 background, which is good. However, with him having the spinal fusion, I would advise him to initially have a chat with the university that he's wanting to go to. Or if he does go directly to an ambulance service, just to kind of ask them that question as to if he's suitable for the role with his qualification, and as well if he can mention the spinal fusion background as well. They'll see as to how they can accommodate him with that condition or with his needs basically.
Okay. Yeah, so just ask and see what's possible. Where there's a will, there's a way, I'm sure.
That's it, yeah. I also got a question from Mark, who wants to know some top tips for interviews for your role.
So I would say is think of all the most impressive things that you've done, write them all down, and then try to, whatever questions asked towards you, have like 4 things that you know you want to talk about, and try to, for some way, incorporate those 4 things into answering the question. So I'm sure it make those 4 things different. So you don't want 4 things of all the same sort of thing. Be like, oh, I achieved this, I did that, and then when they ask you a question, be like, which of those 4 things can I merge into my answer here, so that you've always got something to talk about that you want to get across. And that way you're answering it to suit you rather than just answering it and just blurting out whatever comes into your mind, which is never a good thing. So I'd say that's a good tip, is just writing down and also visualizing, and it should give you some confidence as well once you see all the things that you've been doing, and then going in with that confidence as well. Just knowing that this is the right thing for you and that nobody is already qualified that is applying for it. So nobody is going to be perfect. Everybody has done some things, but not a lot of things. So it's just about just accepting the way that you are, what you've done, and just trying your best, really. And I'm sure that your personality will come through as well. Just try to not be somebody who you're not. Try not to create this picture of this perfect paramedic or orthoptist and pretend to be that person. Instead, just say, this is my interest, this is what I want to do, and maybe have an idea of what you would do, visualize what you would do in the role, so that you can bring that with you, that person with you, to the interview as well. So Amy wants to be a paramedic, but they don't want to go to university. What are the different routes? Is there ways around not going to university for paramedics? I know yourself did college and BTEC, and what are the different routes for you?
Yeah, so there's different ranges of routes that you can take to become a paramedic. So you can either go to college, to university, and then applying for a job after graduating and becoming the paramedic as a newly qualified paramedic. However, there's also different routes to becoming a paramedic. So the university routes takes 3 years. However, different routes to becoming the paramedic can take a slightly little bit longer, or around the same as the kind of 3 years. But there's different level experience you get through it. For example, here at the Yorkshire Ambulance Service, they offer the apprenticeship scheme. So they offer the apprenticeship scheme of where you apply online to become what we call ambulance support worker. So you apply online. That's just a paramedic assistant, so also known in different areas as an emergency care assistant. So you'll be working alongside a paramedic. assisting them in emergencies, and you'll be learning as well how to become that paramedic through them. So you'll be mentored and learning how to become the paramedic, and then after completing your what also known as ASW portfolio, ambulance support worker portfolio, at the end of that you'll get a level 3 qualification. So after you get a level 3 qualification, you'll need some consolidation period of putting what you've learned through that little qualification and then putting it into patient care. After that, you can apply still through the ambulance service. For example, here at Yorkshire Ambulance Service, you can apply to something called the AAP progression route, which is also known as the Associate Ambulance Practitioner route. So you can apply for that, and that's also an apprenticeship route. So it involves a consolidation period, and you'd be it involves a little assessment at the start when applying and putting in your application, and then they'll train you. So they'll start training you with the skills that are required to become a paramedic. So some of the skills, it starts again, communication, patient care, some of the drugs that medication that paramedics would be giving, and then some of the clinical skills that are required to become that paramedic. So they'll be teaching you all of that. That'll be about a year on with the apprenticeship, and then you got to again show some consolidation period after passing your level 4. So it'll be a level 4 qualification you get from that. So in a sense, it's your first year of university. So you would have learned the skills that you would learn the first year of university of the paramedic 3-year degree, and then after that you would apply still within the ambulance service with them assisting you. You'd be applying at one of the local accredited universities. You'll be applying to study the student paramedic route. So what they'll do is they'll put you from year 2. So you'll go from year 2 and then you do year 2 and 3 at the local university, as well as still working for the ambulance service, and build on your knowledge to becoming that competent, clinically safe paramedic, with hope to registering with the HCPC part and becoming that NQP. So there is different routes, and my advice would be just ask your local ambulance service or look online on their recruitment page on their website, search it up on Google, look and see what they offer, because everywhere is offering different kind of programs and at different stages. But it is an opportunity to become a paramedic without having to go to university.
Brilliant. That's really good.
Yeah. I've also got a question for you. It's a question from Stacey, who would like to know if there is a scope of progression within your career.
So I would say to Stacey, definitely. So when you first graduate, you can either do the 3 years, so the pre-registration undergrad degree, or if you've already had a degree, you can do a 2-year sort of advanced postgraduate pre-registration orthoptic degree, and that's at UCL. So we have one in London as well. And once you graduate, you then become a band 5 orthoptist. So you're learning on the job, you're working towards it, or you're just seeing patients, you're focusing on developing your skills. And then you can become a band 6 orthoptist, where you're a specialist orthoptist, you're a capable person, you don't need anybody looking after you or helping you out. You can run clinics on your own, you can have some sort of specialist interest as well, you can have extended roles. I personally did some glaucoma pressure, eye pressure testing. We also had neuro clinics where we were all working in. And then you can become a band 7 orthoptist, where you're leading services, you're organizing clinics, and you're part of delivering and quality assurance of the service and improving that service. And then from there you can go into management, so you can become a deputy or head orthoptist. or you can go down the lecturing route, or you can go down research route as well. Alternatively, you can become an advanced clinical practitioner, where you train for 3 years, you upskill within one area of ophthalmology, or multiple if you like. And then that's, as I said before, you become the same, you run the same sort of clinics as doctors, and you're completely orthoptic led. You can make your own decisions for more complex patients. That's not just within orthoptics, that can be within medical retina, glaucoma, neuro ophthalmology, and that's more of a advanced clinical practice. You also have some sort of leadership as well within that role. You can continue to progress if you like, but without orthoptics, not within it. You can go on to do some sort of NHS management. So our previous head orthoptist here is now chief of AHP at Barts. So he's gone on to progress as well. You can become general manager. It's a really good stepping stone if you're interested in managing in the NHS. Rather than going the business route, you can go as a clinician, which I think is a lot nicer, that you know what it's like to have your own patients, you know what it's like to be the clinician, so you can have more empathy for patients, and more ability to lead those sort of big numbers of staff as well. So it's a great way to go into management as well. So there's lots of different ways that you can progress with orthoptics. At first it seems like a very niche career, but actually it's got a lot of scope, and we are the middleman of eyes. So anywhere you want to go, there are ways. So yeah, that's everything I'd say from ours. Have you got anything else that you'd like to say to anybody interested in paramedic?
Yeah, so I'd just say to them, especially, with the paramedic side of things, just the research again. I'd nail on that. Do your research, and it's an amazing career. You meet all people from different kinds of world background, ethnic backgrounds. You deal with patients you know, from a minor illness to something really serious, whether it's life or death or threats. You go into some amazing locations, and sometimes you yourself, you tend to say, wow, this is amazing, or wow, I never expected to potentially treat a patient in this way and see the outcome where they've been big sick, and because of a certain intervention you've given, the patient might improve in front of you. So there's a range of ways to improving patient care, and most of all, the job that we do, you treat people with respect and dignity, and that's the most important part. And I'd say to anyone wanting to join this career, just bear that in mind. You'll meet everyone from different backgrounds of life, but when you treat people with respect and dignity, and your communication skills is on point, you shouldn't have any problems. So it's definitely a career to consider to whoever's thinking of wanting to join us. And yeah, you'll be an amazing paramedic one day.
Really, I think all AHPs are very underrated, and they're all brilliant careers. A lot of people just think dentistry, medicine, nurse, that's the whole of the NHS, but we're out here. And there's lots of opportunities. So definitely look into it, do your research, and hopefully it will all go well for you.
Yeah. Oh, that's great. Thank you as well. And yeah, I've really enjoyed listening to you and knowing more about your career background and what you do, which has been amazing.
Yeah,
And
same with you. No, it's
yeah.
been really interesting. Keep saving those lives and being on the front line.
Oh, thank you. Thank you. Well,